The WHO modeling now shows a 94% expected drop in death rates on the African continent this year. This is a very big drop. Doctor, can you elaborate on the possible factors influencing such numbers?
Thank you so much. And again, we're glad to join your viewers. I think the drop that we are seeing is primarily driven by the increase in the people that are immunized at present. You recognize that we've had significant efforts to improve vaccination coverage. Plus, of course, people have been getting infected and so have built natural immunity. So a large proportion of the population now has some levels of immunity, which reduces on the expected deaths or severe illness.
All right, doctor, can we then conclude that the pandemic phase is beginning to end for Africa?
I think it's a bit premature to say that. First of all, we know immunity wanes. That means I might be immune today, but over time, the immunity is going to drop, which means if I get infected after a while, I could again get severe disease. We're also still seeing a number of countries, even Kenya itself, South Africa, having recent surges in cases. So we are really not out of the woods. We can see the path to get out of the woods, but we feel that it's still a bit too early for us to fully celebrate.
All right, doctor, picking up on what you've just said, this news comes at a time when most countries are beginning to worry again about lax testing, unchecked transmission of COVID-19, and a possible rise in infections from new variants. Does this modeling tell a contradictory story?
No, I think the story is quite consistent. I think the story basically is putting numbers to what we have known for quite a while, that once somebody gets infected, they develop some level of immunity, which means that their chances of getting severe disease reduced with a subsequent infection. I think what it is doing now is it's putting actual numbers and putting figures to what this reduction in cases of deaths will be. We still found from the analysis that we will still have quite a number of infected people. I think we still expect to see many infections, a lot of waves of infection. But I think what is different now is that we will not see as many deaths as we saw last year. So most people will be getting infected, but would have the milder forms. We will still have people who may get severe disease, particularly if we get new variants. I think we did not model fully the new variants because we do not know what new variants are coming up.